In this video, I present selected pathological findings in the Pes Anserinus region on the medial side of the knee. The cases demonstrate typical ultrasound appearances of pathology in this anatomical area. We now move to the evaluation of the Pes Anserinus region. With the probe positioned longitudinally along the limb over the Pes Anserinus, the tendons are visualized in cross-section. Although this scanning orientation is often sufficient for routine assessment, high-resolution imaging in this case allows more detailed analysis. The typical sonographic features of tendinopathy are confined to the Gracilis tendon. There is focal thickening and reduced echogenicity at the level where the tendon crosses the distal portion of the medial collateral ligament. The remaining Pes Anserinus tendons appear relatively preserved. This selective involvement supports the diagnosis of focal Gracilis tendinopathy rather than diffuse medial pathology. In this example, the probe orientation remains the same. The tendons of the Pes Anserinus are again visualized in cross-section. However, the tendinopathic changes are no longer confined to the Gracilis tendon only. Both the Gracilis and the Semitendinosus tendons demonstrate focal thickening and reduced echogenicity. The abnormal echotexture is most evident at the level where the tendons cross the distal portion of the medial collateral ligament. This pattern suggests more extensive overload of the Pes Anserinus complex. Such combined involvement may be associated with increased mechanical stress along the medial aspect of the knee. This longitudinal view demonstrates a large cystic lesion in the region of the Pes Anserinus. The structure appears well-defined and predominantly hypoechoic, with posterior acoustic enhancement consistent with fluid content. It extends along the course of the Pes Anserinus tendons. While such lesions may be related to local tendon pathology, this appearance may also represent a medially extending parameniscal cyst originating from the medial meniscus. In such cases, the cyst may remain in continuity with the meniscal tear and extend distally toward the Pes Anserinus region. In the transverse projection, the cystic lesion is again clearly visualized, confirming its fluid-filled nature and its relationship to the Pes Anserinus tendons. If you found this material useful, please explore my other musculoskeletal ultrasound videos. You can also watch the tutorial demonstrating a simple way to distinguish the individual Pes Anserinus tendons on ultrasound.